Hello, everyone. Welcome to Rappler Talk. I'm Pia Renada, and today we have with us Mahar Lagmay, who is the Executive Director of the University of the Philippines Resilience Institute, and he's also Director of the NOAA Center. So right now we're going to talk about a very relevant topic, and it's how we manage typhoons and relief operations during this upcoming season, rain season, typhoon season, along with the coronavirus pandemic, which we are still in the middle of. So right now we have Mr. Lagmay, who will talk to us about how we can handle these two calamities, and how these two calamities can affect one another. So hello, Mahar. Thank you so much for joining us today.
Good morning, Pia. Thank you for inviting me.
Okay, so like I said, diba, we are already approaching typhoon season. So lahat ng Pinoys, we all know about this. We all know what happens, the kind of calamities we can expect during the months of June to October. But it's the first time that we're dealing with this kind of calamity alongside the pandemic, the coronavirus pandemic. So people are worried, diba? Like, how do we manage these two calamities? Both calamities are leaching our resources, our manpower. So how do we manage them both? So first question to you, based on your experience or maybe your projections, how do you think typhoons would affect the response to the coronavirus pandemic?
It will be very difficult, Pia, for the simple reason that everybody is vulnerable. We have this pandemic, and we are actually calling it as the COVID-19 crisis. And we know that everybody is in ECQ. We have to practice social distancing. There are certain issues on mobility. And we know that in response for another type of hazard, such as a flood that can be brought about by the incoming typhoons, we're still expecting about 19 to enter the Philippine area of responsibility. And that would affect our ability and capability to respond accordingly. Specifically, evacuation centers, and be able to manage them inside the evacuation centers, because the space is limited. We have to practice to manage such situations.
Mm-hmm.
And it's not only floods that we are talking about. We in the Philippines are at risk from different types of hazards, practically all types of hazards that you can think of, except for snow-related hazards. So these things we must be able to address and think about in advance, so that we can plan and manage it when it comes.
Mm-hmm. So speaking of evacuation,
we call that, we call those kinds of disasters, if it will happen, as compound disasters, or some other people call it as complex emergencies or complex disasters. And there's another term, especially if there's a trigger, and the types of problems will cascade, like in a domino effect. So those are called as cascading disasters.
Mm-hmm.
And this is a relatively new type of topic that is being discussed by the scientific community. It's been around for several years, but relatively new. It doesn't mean that it didn't happen before. In fact, I have a student that is working on cascading hazards, and he has identified a lot of hazards all over the Philippines. And there are a lot of cases wherein there are examples of compound hazards. Like, for example, a landslide would be complicated by extreme rainfall that would generate floods during the response efforts or rescue efforts. And those are called as compound or complex emergencies. But it can be more complex than that. It's not restricted to hazards or what we call as physical hazards, but rather, yes.
Okay. So You mentioned earlier yung evacuation centers and how this is possibly one parang complicating feature of these two calamities. 'Di ba kasi right now we're using evacuation centers as quarantine facilities in many regions. So paano yun? Like if there's a typhoon bigla and they need the evacuation center but it's being used as a quarantine facility, what can you imagine would be the solution to this problem?
Well, the solution of the problem is to plan ahead. We had this example before, well, quite recently during Ambo. And we have that place or province called Eastern Samar. Like the municipalities or cities are Giwan, MacArthur, Hernani. After Haiyan, there were a lot of NGOs and a lot of agencies that helped those municipalities. I mean, heavily mapped. There are a lot of hazard maps. There's a lot of planning that was done after Haiyan at barangay level. So these places are very well equipped and very well planned. Giwan and others. And then come the time that Ambo lashed through Samar, you can see that they did fairly well. And the reason for that, I think, is because of the good planning that were made in the different municipalities of Eastern Samar. They had barangay level maps. Everybody knew where the evacuation centers were. All the evacuation centers were away from flood-prone areas. Evacuation centers did not necessarily have to be a school or a gym. It was an area or a place, maybe a house, which is proximal to their houses or to their homes that is easily accessible. So in that sense, they knew how to manage the floods. And of course, the strong winds would be managed by the sturdiness of their infrastructure, the buildings, the schools, or the houses. And the people in Samar are quite used to that. So they know what strong winds are. And come the time when the Philippines had the pandemic, they isolated themselves. They were very strict. We were talking to the governor recently in one of the programs, and he outlined what they did in Eastern Samar. They wouldn't just let anybody come in Eastern Samar. Although they're worried that when the OFWs come back, there will be a lot who will be entering their place to complicate the situation. So they're trying to address that. So what I'm saying here is that they did well in the pandemic. They knew what to do in advance for handling the typhoon. And I think that is a good example on how cities and municipalities should address what we call as complex emergencies. We have been working with many NGOs. We call ourselves, or they call themselves as the START Network, and they have partnered with us. This include Oxfam, I think Christian Aid. There are many in that network. So we have before been discussing about these things, what we call as complex hazards, as I mentioned, anticipating these other hazards that may complicate our current situation. These include not only the flood problem, but also the other problems. What if we have an earthquake, for example, or if we have Taal erupting again? So that will really be complicated. And this is a relatively new, as I said, relatively new topic that we should really address and think about it more, execute it in terms of planning down to municipal level. We really have a long way to go, but there's always a start.
In terms of government resources, do you think the government has enough funds to be able to manage both the pandemic and calamities like typhoons or earthquakes?
It depends on how things unfold. Of course, it will be dependent as well on our decision making, how long the crisis will extend, and with proper decision making, hopefully that the crisis will be shortened, especially if we have a discovery of a vaccine that will come out soon. So I cannot really say on or answer your question definitely or with definitiveness. It will all depend on our decisions. It will all depend on our resources, our economy, our funds. Everything interacts. So it's quite difficult to answer that question on whether we can handle it. So far, we are handling it, but soon we need to strike a balance between health and the economy, because we don't like people to get hungry. So you may be free from COVID, but people are not eating anything. That is going to be difficult. So government tries to balance between the health and the economic situation. We may need to open again soon. That may lead to a second wave. But what is important in flattening the curve is that we are able to limit it in such a level before the vaccine is discovered. Limit it in such a level that our healthcare system will be able to accommodate the patients that come in the hospitals, and there are enough doctors and equipment, PPEs, ventilators, ICU beds, and so on. That's the meaning of the flattening of the curve, according to the Center for Disasters Control and Prevention, or what we call as the CDC. And you can see now that because of the ECQ, the physical manifestation of the effectiveness of the flattening of the curve is that there are many ICU beds, many ventilators, many hospitals that are not 100% occupied or used. We are at the level of below 50%. So that means that the healthcare system is not overwhelmed.
Wait, so sorry, below 50% nationwide?
I'm not sure if it's nationwide, if the database is nationwide, but I would imagine that it is. I'll have to check on that, Pia, but I would imagine that that database is representative of the majority nationwide of the ventilators, ICU beds, critical beds, care facility beds, and so on. So it does not mean that we have to be lax about getting things done, because the moment that we open up and make the economy better or boost the economy after the ECQ, then there will be more transmissions because we're doing our normal operations, and the virus likes that when people interact, because the host the host is the person, the individual. So when they interact, we tend to transmit. So we expect a second wave to happen when we transition from ECQ to GCQ, and to I don't like to call it normal, because the virus will be around until we achieve herd immunity and we are able to discover a vaccine. So that's very, very complicated, and we need to strike a balance between health and the economy.
Okay. There's such a thing as we have LGUs that have NDRRMC funds in case of natural calamities. Do you suggest a separate fund just dedicated to fighting outbreaks, given that the system is something LGUs draw from every time a calamity? They have these funds available.
I don't know how the system works. I think the funds are also used. Like, for example, I know Quezon City has a lot of funds for DRR, and I'm sure partly or a large part of it they use for the crisis. Yeah, but I'm not really. Yeah, yes, for the pandemic, for the crisis that we have now. Um, I really cannot answer that because I don't know how to address, or I don't have information about how the funds flow.
Mm-hmm.
But what I know is that there are a lot of funds that have been taken out from the different agencies, pulled together, and given to DSWD for the social amelioration program.
Mhm. Okay. So earlier kasi you spoke of Eastern Samar and how it was able to handle both the pandemic and Typhoon Ambo. But we also want to look at areas in the Philippines that are under stricter lockdowns, like Metro Manila, Cebu City. These are highly urbanized areas, and we know that when typhoons hit highly urbanized areas, the dynamics are different, right? The resources are different. The lay of the land is different. So given that lockdown measures mean limited transportation, people can't move around as well. They're also stuck at home, and there are evacuation centers being used as quarantine facilities. How then would you see us managing a typhoon hitting, for example, Metro Manila or Cebu, given that this is the way things are now? People can't leave their houses and people are stuck at home and they have no trains or other transportation.
Disasters are most difficult to handle in populated areas, especially Metro Manila, which is densely populated, and it's overcrowded. It's not unique to Metro Manila. Any city or any metropolis that is overcrowded and densely planned or poorly planned, when a crisis or a hazard strikes that area or that metropolis, disasters are always difficult to manage. It's not only for the pandemic, for COVID-19, it's for any type of hazard. Why is that so? It's because there are so many people that your funds are overwhelmed when the crisis happens or the disaster strikes. And it's difficult to get people into evacuation centers. And there are many people who are exposed to the hazards. And it's very, very difficult, really. I think last year I was trying to, or in an interview with Eco Business, something to that effect was mentioned, that we need to look at the density of Metro Manila. And it's really overcrowded. And when we talk about disasters, those questions that you are asking me now, it will be really very difficult to manage. So I was suggesting that maybe, like for example, Indonesia, they want to transfer to another area, their capital. Maybe that would be a good idea as well for the Philippines, because Manila is really overcrowded. And we need to transfer at least the government buildings, the seat of government, to another place to ease the congestion in the metropolis.
Mm-hmm. In the immediate though, given the implications of a lockdown, for example, like people have to stay at home, but during a typhoon, if there's, for example, flooding in their barangay, they usually move out of their houses into, for example, an evacuation center or to higher ground. But given the dangers of spreading the virus, how would you then have officials manage that? Like, they need to move people, but then people could be scared to congregate. I mean, paano yun, diba? How do we manage that?
Pia, if it happens, that hypothetical scenario that you're saying, which may really happen, and there's a high chance that it will happen. If it does, it's too late. It will really be difficult. What I'm trying to suggest is that all of these actions that we need to do against these scenarios that you are saying or asking me should have been thought of a long time ago. It should have been included in the planning process. It will still be difficult to do that, to put it in the planning process so that we are already knowledgeable of what to do. But it will be much, much less of a problem if we have incorporated it and thought about it a long time ago. and included in the planning process of the LGU.
Mm.
So right now, if you're asking me, what are we supposed to do if that happens, my answer is that it's too late. We will have to suffer the consequences because we did not plan ahead. Of course, we can still do some remedial measures and try to address the problem, but I don't know to what extent will its effectivity be. So all of these things need to be planned very well, long in advance. We have to anticipate. We have to expect the unexpected. We have that comprehensive land use plan. We have local climate change action plans. We have a lot of other plans that are being done by the local government units. And I don't think this kind of situation has been included in the plans of LGUs. Maybe we should include it now because this pandemic will not be the last. It will repeat itself. And there will be compounding factors, complex disasters that may happen. And if they do happen, we want to be prepared. After all, that is the business of disaster risk reduction. Prevention and mitigation, preparation, and to be able to do that, we have to plan ahead.
You mentioned remedial measures. I mean, given, it's too late now, but you're saying there might be some small things we can do to help the situation. Could you name a few of those remedial measures?
Like, for example, we can already identify those places that are not flood prone. So that means that all of the people in the non-flood prone areas can stay at their homes. They don't need to go to the evacuation centers. But do we have that? Do we know already exactly where the flood prone areas are? Those are the Quezon City has those flood maps.
Geohazard maps.
So they know already what the flood prone areas are. For those that are who are in the flood prone areas, they are the ones to be put into the evacuation center. So before the next typhoon comes, we should know the number of those people in flood prone areas and to what extent the inundation will be. Count them and match it against the evacuation centers. Match it against the plan form of the evacuation center. How many square meters it is? What is the social distancing required? If we've done that, then we stand a better chance of addressing that problem. But that is Quezon City. Quezon City is, Quezon City is very, very large compared to the other cities of Metro Manila. So it might be more complicated for the other areas. But I think there are small things. We need to think about it. You need to spend some time thinking about it to have some remedial measures, some mga ad hoc solutions now that the problem is here. But we need to spend time thinking about them.
Would you also suggest maybe a stock of face masks para pag dumating sa evacuation centers, like the government should be able to give every evacuee PPEs?
Oh yes, that can be one. Stock of face masks, or maybe now, if there's a lack of face masks, maybe we can make our own face mask and put a filter. I don't know what kind of filter that is. It's cheaper than the face mask, but everybody now can make their own face mask and with a pocket where you can put the filter. So those might work. It might not be as great or as good as the commercial face mask, the N95 face mask, but I think there, up to a certain extent, you are limiting the spread of the virus if you do have those face masks. So again, you're asking me now these things. We need to spend time. There are so many little things that we can do that if we pile them up or put them together, it adds up to a lot. But again, we need to spend time thinking about it now before the typhoons come in. It's called anticipation.
Okay. Going back to the anticipating other effects of the typhoons, so we also know that typhoon season brings about its own health impacts, right? So we have sicknesses like dengue and other sicknesses which are vector-borne, vector-based. So how do you or other experts you've talked to in your institute see any effect of these diseases to the current pandemic?
Of course, there will be complications. The immediate one that I see is that when there are floods, we have problems on leptospirosis. We have problems on maybe dengue because there's a correlation between the wet months and the occurrence of dengue. From what I've been reading, it will add up because if we have more people who are sick at the same time that there are people who are sick from COVID, there will be more work for the doctors in the hospitals. There will be more facilities that will be needed in the hospitals. We don't like the hospitals to be overwhelmed during this time of the pandemic. Because if the hospitals are overwhelmed, you have to prepare your body bags.
How would typhoons and the ensuing government resource spending and movement of people to evacuation centers or other impacts affect testing?
Dali lang ha, let me think about that. Hirap ng tanong mo. How would it affect testing?
Kasi syempre people have to go to these mega swabbing centers or their barangay health clinic, right? But may bagyo.
Right.
And they're worried about maybe they're stocking up on food or worried about their safety going out. Or flooding could maybe affect the centers. I'm just like thinking worst case scenario.
Yeah. Well, okay, that's it's another compounding factor, and there are many compounding factors. When there's a typhoon, again, there will be other diseases that may occur that will increase during that time, like leptospirosis, and if you have to take care of these people, it's not just the doctors really taking care of the people and the nurses taking care of the sick people. It will also have to affect the capability of the hospital because of the facilities that are going to be used. So that might also impact on the other human resource, mga medical technicians, mga medical related professionals. And the reason why I'm saying that is because we don't want the hospitals or our hospital care system to be overwhelmed. So I guess there will be an effect on testing as well, because testing is one of the functions being done by many hospitals, both public and private. I don't know if some of the testing centers are just solely dedicated for testing, but maybe they will be impacted less compared to the hospitals who are doing everything related to hospital care.
So that was Mr. Mahar Lagmay from the UPRI, who spoke to us about how we can manage both typhoon season and the coronavirus pandemic. Again, this has been Pia Renada. Thank you for watching Rappler Talk.